Welcome to another Deep Surface Healing Massage video. My name is Lamar Wilkinson. I am a clinical massage and strength recovery specialist. And in this video, we have a client who is suffering from some radicular symptoms. So this is numbing, tingling, radiating pain. It's coming down through her right side into her arm and hand. And it is due to the biomechanics of her occupation. She's also reporting some pretty moderate to severe migraines, but very frequently throughout the week. So we also try to tackle that too. In the assessment, you are going to see how the position that her body is the biggest contributing factor to her dysfunction, as with most people. So you'll see me use the Osla method. Yeah, it's just I'm breaking down every client's occupation, their sleep, their lounging, and their activities throughout the day to see what positions they are staying in for too long and compromising themselves over time. So, on to that assessment.
We're here for part 2, yes?
Yes.
So, first time you came in, we talked about your occupation, ultrasound, right?
Yes. Yes.
And how it is pretty detrimental to your overall health and wellness, quality of life. And we are, let's just go over everything that we were dealing with. Let's start with radicular pain, numbing, tingling, radiating pain.
Yes.
Yeah, and that's our right side, yes?
Yes. Right and left side it was.
Right and left.
But worse on the right, I would say.
Okay. Radicular, right and left. And you said more on the right.
Yeah.
Yeah. Okay, so alligator wants to eat the right side. Cool. Okay, and we were dealing with headaches?
Headache.
Yeah, migraines, yes?
Yeah. And that's all on the, it was pretty much left-sided.
Migraine, left side.
Yeah.
Yeah. Yeah, that checks out too because of the way that you have your head situated.
Mm-hmm.
Yeah. Just for the, we'll pretend your patient's here. And if I could just have you get back into that position. Yeah, see, working out here. We've got short here. The shoulder's going to be up during this. We're going to be holding tension here. Head's going to be turned this way.
It's going to be turned this way or looking like this.
Yeah.
So, but yeah, a lot of it's this way.
Yeah, so we're going to be short here, and then we got tension from the lengthened forward head coming this way, and then the turn. Yep, so that tension here. So I can definitely see how tension headaches are showing the symptoms of a migraine.
Yes.
So we reduce the tension here. We should be able to reduce migraine symptoms. Actually, we did work quite a bit. More so on the right side. But did your headaches reduce frequency or severity?
Did reduce. The severity is definitely gone. I still feel it mostly in my neck, and it'll radiate up there, but it's not anything like it was beforehand.
Fantastic. Okay, so we're successful there.
Yeah.
But on the right side, what are we still dealing with?
I still get some numbness in my hand. It's definitely decreased from what it was. It used to be right away that I would start getting that numbness and tingling when I'm doing my job and stuff.
Yeah.
And now it'll be if I'm holding a certain position and not moving and trying to just hold everything exactly how I am, then I'll start to feel it. But when I stop, it goes away faster too.
Yeah.
It doesn't kind of hang out as long.
Yeah. Okay. So the threshold of the amount of overload and strain in that shoulder girdle and in the neck and in the forearm is increased a bit.
Yeah.
Yeah. You can take a little bit more. So over time, if we don't continue to decompress here and then work on strengthening what's weak in the chain, it's going to, the symptoms will, slowly build back over time. Right. A little bit of micro trauma every day is pretty much what everybody's job comes down to.
Right.
Yeah. So we're going to keep improving on this area here. Yeah. We're still going to share some time for the left side because we want to try and eliminate, headaches altogether.
Absolutely.
So, okay. Let's have you come up and we'll see what your ranges look like.
Okay.
Okay. Ugh.
Right there, yeah.
I
on
feel
left
it.
Side.
Ugh. What position are we sleeping in again?
On my side.
On side,
Yeah.
knees up, fetal.
Yep.
Yeah, chin tucked down.
Yep.
Okay, yeah. What's arms doing? This one in particular.
They're usually like out like this.
Okay. I'm looking for where we make this short.
Yeah.
Yeah. What's this do when you're doing ultrasound with this arm? What's the left arm doing?
It's up on the keyboard like this.
Okay, yeah. That's where we get our closing here. Okay, so what about upper pecs?
Yeah.
Which side more?
I think the left more than the right.
Ooh, maybe because we didn't show as much love to the left side. So I remember the right side was pretty lit up last time. Okay. Let's see how well we laterally flex. So we're just going to try to tilt. Oh, man. That actually looks pretty good. But what do we feel on this side?
I can just feel it, like but I almost have like just a constant like kind of like ache right here. But
just kind of feel like dead center here.
Yeah.
Okay. All right, and let's go to the other side. Man, we're clearing 45 pretty good.
Yeah.
But what do we feel?
That doesn't really bother me at all. Yeah.
Okay. And then chin down. Okay. So, anything this far down?
Just a little.
Just a little bit? What about here?
Yeah, you can feel it more there.
Yeah? And then here?
Oh, yeah.
Yeah? Yeah? What about way up?
Just on the
Right
left side.
Okay,
yeah.
just left side.
Yeah.
And suboccipitals. Okay, but here, both sides.
Yeah.
Yeah? Any one more than the other?
Probably the left more than the right.
Yeah? Oh, man, maybe we should spend a little more time on that left side. Right side seems to be coming along. Let's see about rotator cuff here.
Yep.
Yeah? Between 1 and 10 when I put pressure here.
8.
An 8?
Yeah.
Oh my goodness. Okay.
I definitely feel that.
Okay. Well, we can calm this down.
Okay.
And then we'll show you how to strengthen it.
Okay.
Yeah. Okay. So if I get closer to that common tendon though, more pain?
Less than when it was when you were down lower.
Okay. So more as we get here.
Yeah, like right through there.
Okay. Okay. Cool. Well, let's see about the right side.
Okay. Yeah, right there.
Yeah?
It's just like an 8.
Same thing, infraspinatus, both sides.
Yeah.
Pretty sore, about an 8. Okay. We'll work to calm those down.
Okay.
Same as last time. We know we've got anterior chain in the front is closed due to the job, due to the sleeping patterns with the chin down and arms over. So I'm going to open this up.
Okay.
Get the range open, and then we'll calm down over lengthened, weakened muscles in the back there.
Okay.
Take a look at your scapular rhythm and see just how much tension is in those rotators in the back. Okay, we'll feel the side here. No jaw clenching, grinding teeth.
I grind my teeth.
Yeah. Would you believe me if I said that comes from tension?
Oh.
Yeah, in the neck and shoulders.
Yeah.
This is where they all lead up.
Yeah.
So, feel.
Yeah.
Yeah, and then.
Yeah.
A lot of our TMJ disorders are from people who also exhibit issues in the shoulder girdles, muscles in the upper back neck, and shoulders, because that tension comes up. Tension in here.
Yeah.
A lot of times some people they'll come in and report migraines.
Yeah.
They've been to the dentist. They had to hold their mouth open for long periods of time, putting strain in weak muscle. Yeah. That's been in an environment of tension. So, all right. All of our goals are pretty clear here. We want to continue working on bringing that numbness down. We can't. Last time we were able to recreate it. Let's see if we still can.
Okay.
So just relax here.
Okay.
And I'm going to turn that arm out. And then I'm going to bend. I'm going to extend the wrist. Let me know if you feel it.
Starting to.
Yep, starting to.
Yeah.
Okay, raise the shoulder up on its own. Go away.
Yes.
Okay, and let's bring it back down. Let me know when it starts.
Okay, right there.
Okay, and let's raise the shoulder up. Let me know when it goes away.
Yep.
Okay, all right, so maybe about a 6-7 second kind of thing going on here.
Yeah.
See if we can get that to increase.
Okay.
So So when we hyperextend wrist, we get about 7 seconds before it yields rad symptom. Let's see if we can get that up.
And there you have it. That is why it is extremely important for your therapist to go over the occupation, the sleep, the lounging, and also daily activities, the position that your body is in. If you are working with someone who understands biomechanics, arthrokinematics, how the body moves, we can understand where stress and overload is in the kinetic chain, and we can work to arrest and reverse musculoskeletal dysfunction by simply understanding what a muscle is supposed to do and how we've been taking advantage of it. So from the assessment, it's clear that we want to open up the muscles in the anterior chain that are hypercontracted and stop them from influencing the muscles of the posterior chain that are over lengthened and weak. A lot of times you get reports from people who are just seeing therapists that are working the areas they can feel. But you want to make sure that you're thorough about any of the antagonist muscles that are also acting as an opposing influence in the areas where we are feeling pain. So after this, we're going to see the massage, basically the flow pattern that I use, not just with this specific client, but most most of the time when we're dealing with radicular symptoms, trying to relieve compressed areas around the nerve root. Afterwards, you're going to see the post results and then also the pre and post results of session 3 and 4. So let's see how well we do.
Okay, so now we're going to try and lift chin up. There we go. Come for that SCM. How we doing in here?
I feel it.
Feeling it. And with the chin up, let's have you turn away from me slowly. Yep, there we go. And then back towards me. Good. Whew.
I didn't even know there was like muscles all
Oh,
here.
yeah.
I definitely feel them.
See, when these muscles, like the scalenes, SCM, coming through here and they insert up and around that base of the skull here, when they're strained there, they send that inflammation up the chain. And then the next joint comes right up into that TMJ. When we start thinking about TMJ issues as referred pain, we get better results. So we figure out where it's coming from.
It's all very interesting.
Yeah. Body's just one big domino. You just wanna. The tricky part is finding the last piece to fall.
Yeah.
And the first. How are you feeling in here?
I feel it.
Yeah. This is you keeping this out.
Yeah.
That medial delt engaged for long periods of time. So we're actually going to see what the bias tries and see what we feel like here. I'm just thinking about how one of my mentors would kill me if she saw me just taking lotion and putting it on you instead of like spreading it in my hands. Yeah. Like, you're not painting them, Lamar. Okay, let that elbow fall. Yep. Just let your arm fall. I got it. There we go. Easier said than done.
Right.
Once I start taking control, you're going to want to take control. Ooh. Feeling spicy here. Yeah, they don't like me here. I feel it.
Me too.
And we'll reach down with the shoulder. Yep. Okay, a little more out of the right arm than we thought.
Yeah.
Take a break. Stop bullying that side. Whew.
Yeah.
Yeah. We're just a little more present here. All right, so same deal. I'll put some pressure here in the upper pec and then have you slowly turn right. Okay, and come back neutral. And we'll come forward a bit. Try that again. Yeah. Feel that here?
Mm-hmm.
Yeah, okay. So just have you relax like that. And we'll come open it up. Oof. Oh, man, it's revealing itself here.
Yeah, I've been feeling it there this whole past week and stuff, just kind of soreness.
And we want to
stuff.
externally rotate the shoulder. There we go. Do you celebrate Christmas?
Yes.
So, let's talk about gift wrapping. Yeah? We do any of that?
Oh, yeah, definitely.
Yeah, see? Gift wrapping. What about decorations?
Yeah.
Yeah, we up on ladders. We doing ornaments.
We're doing ornaments.
Uh-huh. You take them down yet?
Yep, they're all down.
Okay. The holiday season, that's what I get. I get shoveling snow, injuries. I get overload from lights and decorations, and gift wrapping. Just because standing, tilting with the torso, so like flexing that hip over long periods of time, putting strain in the low back. Yep, arms forward, chin down.
Makes a lot of sense.
Yep. So we get a good bit in January. What we feeling?
Say it again.
What we feeling? Any ridiculous symptoms coming through here?
No.
Okay, good. Ooh.
Yeah.
Yeah.
That part of my neck never likes me.
Yeah. Got plenty of time to soften him up. Kids have a 4-day weekend, or?
I know they had a 3-day.
Yeah. I think some kids were off Friday too.
Yeah. I thought mine were, and then they weren't, and I'm like, okay, good. I was off Friday, and I had spent the whole day just getting everything ready for the long weekend. And like I said, we drove up to Chicago and was up there for a hockey tournament. So
Ooh.
I had to just make sure everybody had everything.
Who drove to Chicago?
My husband.
Okay, all right, I'll take that.
Yeah, you have to be a passenger.
Hockey tournament.
Yep.
Yeah, how old?
He's 11, so I play on like a U12 team.
I have another client whose boy is 10.
Yeah.
And they just recently lost. They didn't get to go to the whatever the
yeah, like the finals or whatever.
Yeah, whatever the national or finals are.
Yeah.
But they were up in Columbus over the
Okay.
last week is where they played. I asked her how aggressive the game is when children play. Like, do they have like the little timeout box where you get to fight each other?
Yeah. I can't check until, let's see, what, U14, I think. So.
Oh, okay.
My son's excited once he gets to make that jump, which won't be for a couple more years. And I'm like, come on.
Can't wait to run a guy over for looking at me sideways. Yeah. Starting to listen.
Yeah, I would like it to listen all the way.
Yeah. We got this little combination here where like work biomechanics has this like lengthened out, like forward.
Yeah.
But when you sleep, you bring the shoulder up. So I've got like little combos of like over lengthened muscle and then also like short muscle. Just kind of depending on which muscles are keeping your shoulder up and then which ones are keeping your head forward.
And then I'm a lefty too, so then I do everything.
Oh, we're left dominant as well.
Yes.
Oh, this is even worse than the right side.
Yeah.
For sure.
This is where it hurts like all the time.
Yeah. So I'll ask you now before I forget, but next Wednesday looking clear?
Next Wednesday. I think so.
Okay.
Yeah.
Check back with you.
I don't think I have anything planned.
Okay, now we'll externally rotate and bring that shoulder down. And we'll try to get into the scalene here. And slowly turn away from me. Yep, very good. Mm-hmm.
Yep.
Whew. Yeah, that's how we come back neutral. Yep, yep, yep. Mm-hmm. Mm-hmm. Okay. All right, let's look at our levels of tension here. Okay. We're definitely going to come for the left side first. Yeah, I can see in the hips. Okay, okay. Fought a bear.
You would?
So you fought a bear?
I was born with like a big mole on my back that they had to remove.
Oh, okay.
I was like 7 with it, so I've had that scar forever. But we'll go with I fought a bear.
You said what?
I said we'll go with I fought a bear.
Yeah, there you go. quality. I'm gonna poke core here. Yeah, yeah. Ooh. Okay, yep, angry.
Yeah.
That's just that forward sitting.
Yeah.
Yeah, core in the front short, core in the back long. So I'm just feeling just how kind of taut and the strain kind of in the low back, mid back erectors here in the core. It's just typical of the sitting posture. It's time to get yoked. Some deadlifts. And you don't have to go straight to deadlifts, of course. You know, back extension machine. Mm-hmm. All right, see what this tension's doing. Come back to the left. We'll see what the right side wants to give us first. Yeah. Try to reach that shoulder down. Yep, reach all the way down as far as you can. Now we're gonna look for that. Look for that up here somewhere. Yeah. See? Not so bad. All right. Yep, relax, I got it. Right in here. Oh, yeah. Mm-hmm. There we go. Feel that guy there? Ooh. Mm-hmm. Now let's come back to the left, see if we can get it to match. Mm-hmm. Mm-hmm. Woo! More so than the right side?
Yeah.
Yeah, I feel that. Ooh. Okay. Okay, so let's go for radicular tests.
Okay.
First. And so I'll turn, externally rotate, and then we'll hear 2, 3. We're at 10.
Just, yeah. I said I'm just kind of starting to feel it just a little
Just a little bit?
Yeah.
Okay.
Nothing like.
Let me know when we feel it like we normally would.
Okay.
Like before when we first tested it. Or if it's increasing at all.
Yep, right now.
Starting to go up now?
Yep.
Okay, all right. I feel like that's pretty well over 20.
Yeah.
But good. Definitely better.
Definitely better.
We have much, much more comfort in the passages where the nerves are coming through.
Yeah.
Because they're surrounded by tense muscle all the time. Yeah, that's how that compression happens.
Yeah.
So definitely our thoracic outlet channel where those nerves stem from, the cervical spine. It's all about keeping them comfortable through there, getting good blood. Oh, look at that.
I know.
That's much better there. Let's try leaning. Oh, wow. That's a lot better. Yeah. Okay, let's lean this way. Okay. This is still decent.
Yeah.
But yeah, right in here.
Yeah.
We could still use some work. But let's lean this way again and let me know if we're feeling the same amount.
I feel it like down through here more, but less than when it was before.
Okay, good. Let's have you come back up neutral. Fantastic. Okay. Yeah, so gonna be sore.
Yeah.
Gotta be sore. But good work.
Yeah.
Good work today. So what we're looking out for is how many hours pass before we start to get radicular symptoms at work?
How many hours?
Yeah. Like in the beginning, I know you said it was like 0 to 1.
Yeah, exactly. I can probably get till like lunchtime before.
Yeah.
So I would say
Okay, so like a half day?
Yeah.
Okay. Let's see if we can get to like 3/4.
Okay.
Yeah, or even like a full day, or like at the end of the days where you start feeling it.
Okay.
Right? Yeah. So we will try to revisit this again in a week.
Okay.
We'll also keep track of like migraines.
Okay.
Frequency. You weren't how many were you having a week?
It was almost all the time. I would say probably a good 4 or 5 days that I was having that pain.
Yeah, okay. 4.5 days a week.
Yeah.
And what do we reduce that to the first time, not today?
The first time, I would say like 2 to 3.
Yeah, like 2 to 3?
Yeah.
Okay, so we'll say 2.5 a week. So hopefully, that was like 3 weeks ago or something like that.
Yeah.
Yeah, so we knocked it down today, and then we're going to try to knock it down another 7 days.
Okay.
Yeah, so we can get this to like a 0.5.
Okay.
Is like our magic number. I definitely would say, like, of course, I'm not allowed to like diagnose or anything, but your migraines are definitely coming from like their foundation is a tension headache.
Yeah.
Yeah, and they're morphing and starting to present symptoms like a migraine. So what we want to do is take that tension down so that because if we don't do anything about the tension, if we don't stay on top of it, the like threshold that your body has between like a tension and like a tension migraine, it's going to get shorter and shorter. And eventually there'll be like no difference between the tension and the migraine. Like it'll just be one giant like aura of pain up on your crown. So, so good. Okay. Session 3. That was a Wednesday. Today's Tuesday, so 6 days, right? Yeah. Okay, so first, I want to hear about migraine.
Definitely less frequent. I feel like I did have one yesterday. It was the first time I had one like all week.
Okay, so between last week and today, you had one. One. Yep. Nice. It was 2.5 last time. Yes. Yeah. Fantastic. So that's good. And severity. How bad was it?
It's definitely down than when it was before. Yeah. Like, oh, goodness. I would say it probably got to like maybe like a 5 to 6 range at its worst. Like when I'm like, okay, I gotta like take something just to kind of help it out.
Okay. What's your usual?
Usually I would get up to like an 8 or a 9. Yeah.
Okay.
To where I'm like I can't function.
So we'll say 5.5, and that's down. And you said it was about an 8.
Yeah.
Before about an 8. Okay, I'll take that. Tell me how much time it takes before you start getting the radicular symptoms in right hand. Last session, we were up to about half the day.
Yes. I'm trying to think I might have had like some. It was probably about the same, about half a day, but it's definitely less.
Yeah.
And it doesn't last very long. Like once I kind of stop what I'm doing, it goes right away. It goes away right away.
Symptoms are less severe.
Yes.
And they linger less.
Linger less.
Yeah.
Definitely.
Cool. I like that. Okay. Well, we will keep trying to reduce these things.
Okay.
Yeah. We're just gonna hit the same areas the same way. Nothing particularly different.
Okay.
So. Yeah, we can finish off this right side for sure. See how well we lean. And other way. Yeah, see, this is what we want to improve. I can feel the resistance there.
Yeah.
You see, last week, I forgotten that you have a little bit of additional laxity in the joints. Because I was like, oh, man, lateral flexion, so good. Yep, got me. Still an 8 here.
Yep.
And other side.
Feel it.
Not
right
as bad.
There. Not as bad as the left side.
That's that difference in here. We at least get some contraction here for like external rotation in the shoulder, but here is much more forward.
Yeah.
So this is like lengthened more, gets tired, gets more strain. Okay. All right. Okay, so end of session 3. First of all, how are we feeling?
Very relaxed.
Yeah? That's good, because we went we were a bit tough on the right side today.
Yeah.
So. Oh man, that's so much better. Yeah, still some difficulty in here, but man, that's way better. Good.
Feels a lot better.
Let's see you lean.
This way?
Yeah, less resistance. Very good. Come back neutral and try that again. Yes, very good. Less resistance here. There we go. Very good. Okay, let's lean the other way. Yeah, good. Just playing catch up with both sides here. Man, I don't remember this being this tough last week, but I want to see if we'll just kind of test your outlet chain here again. We got pretty much beyond 20 before you got symptoms. Yeah. 1, 2, 3.
A little bit right now.
Okay. Let me know when it turns up.
Right there.
Ooh, okay. Past the 30 seconds. Good. And a longer time before you start feeling some light things. Good. So, good. We doing the doorway stretch?
Yes.
Good.
Every day.
Good. Keep locking that in before you go to bed, when you wake up.
Okay.
2 most important times. Those are the sacred times. If you skip or miss or forget any other time during the day, the day's biomechanics, the tension from that has to come off before you go to bed. And then your sleeping patterns, you have to, the tension of being in that position for 6 to 8 hours or whatever.
Yeah.
When you wake up, you have to be like a cat and stretch that out too.
Okay.
Yeah. So, another 7 days will pass.
Okay.
And we will try to get this somewhere like here.
Okay.
Yeah. We'll say it'll used to be 5.5. We'll put that thought out there.
Okay, I like that.
Yeah, and we'll try to get this to 3/4 of the day.
Okay.
Before you have 2 work days before I potentially can see you again.
I'll have 3 because I work
3?
the weekend, yes.
Ooh, okay. That'd be good though. You normally work 3?
No.
Yeah, it was 2, right?
Yeah.
Okay. Well, that's even better. Yeah. Well, they'll put my skills to the test here.
Absolutely.
And see after 3 work days, after the 3rd session, if we still can knock these numbers down.
That would be
yeah.
awesome.
Fantastic.
Yes, definitely.
Okay. All right.
Yes.
Go on. Let's see that again. You said you couldn't do what?
I couldn't cross my arms.
You couldn't cross your arms?
No.
Well, what did it look like when you tried?
I would be like this, like I could almost get there, but now and it was uncomfortable.
Yeah.
And so now I can just cross my arms like this and
Interesting.
like that, which was I don't know, it's like the little things in life that
Yeah.
you don't realize that
life without sass. I can't imagine.
I know. So I'm very impressed with that.
Good. Okay. This is session 4. Yes. Okay, so we know we're back from a 3-day work week.
Yes.
Yeah. So tell me about the number of migraines you had between the last time I saw you and today.
I think I had 1.
1.
Yes.
Okay. And the severity?
I would say it probably got to maybe a 6.
Like a 6?
Yeah.
Oof.
Yeah, it was a little bit more rough.
Yeah?
But,
Because of the additional day?
probably, I'm sure it was.
What about rat symptoms?
Oh, much better.
Yeah?
Yes.
Okay, so an improvement here.
Oh, definitely. I noticed on Saturday, I was doing one of those exams that I had to kind of push a little bit harder and maintain where I was at and stuff like that. And I'm I I think it was like at the very end
Yeah.
that like I started kind of feeling it, just a little bit, but
Yeah.
I made it through like that whole exam, and then even afterwards, like my arm and my wrist like felt so much better than it was.
Okay.
That I had. So I was really impressed.
Okay. So, rad symptoms, except for like some of the more strenuous activities that you do for work.
Yes,
yeah, are pretty much not there.
Correct.
Yeah?
Correct.
Okay.
Yes.
Okay. So, this was our biggest improvement here.
Definitely.
A little more work
A little bit more work on the migraines.
for migraines.
Again, it's all on the left. It usually happens on the left side of my
Yeah.
head.
And then also because we know that we're dealing with at least some amount of cervicogenic things like that. So the tension buildup and the strain of the muscle gives way to apathy.
Yes.
Or not apathy, but atrophy. Yeah. So the muscle weakens over time.
Yes.
So even though we can get these levels down, this might just be as far as I can take you with like clinical massage.
Right.
And the rest would just be strengthening the chain. Yeah. And then ultimately changing our biomechanics.
Right.
Yeah. But how are we feeling right now?
Pretty good. Yeah,
Okay.
Yeah. I feel like just a little bit of tension here, I think. But other than that, I don't feel terrible.
Yeah. Okay.
Always a good thing.
We are gonna run the same circuit.
Okay.
Yeah. We'll see how you feel afterwards.
Okay. So.
All right. So that's 4.
Yes.
Yeah. So can you tell me again about how you would normally feel after a work week, especially on like the rare 3-day kind of work ones? Yeah.
I would be very achy. Usually, like my neck and my shoulders would just ache constantly, and even like taking like an ibuprofen or anything like that, like would maybe take the edge off a little bit, but it would still like all be there, and it would just usually take me a couple days to like recover and start to like not feel so bad. Yeah. Afterwards.
Okay, but having worked on you last week, how do we fare after the 3 days?
It's a lot better.
Okay.
Like I was just very impressed with how my arm felt too, like after working, because usually it would ache after like a couple patients. And I made it through the whole day, pretty much, like not feeling as achy, and like I could do like one patient right after the other and not have to like stretch out my arm and kind of massage it and all that kind of stuff. And the numbness is definitely better. I'm really impressed with that. Like I just didn't think just having it worked on and like massage worked out would make such a difference, and how it's feeling and how I can work at work. So
it usually the step-by-step is weakness in the kinetic chain due to overload. Daily occupation will start to develop small little amounts of micro trauma surrounding muscles, the tendons, that overload. The natural response is to like swell up as a response to tension, but it just gets in the way of our nerve roots, and that kind of compression on the nerve is what sends us that ridiculous symptom. So we came in primarily for the ridiculous symptoms, and we have dealt with these quite a bit.
Absolutely.
Here. We've got the amount of time that you can work before you start to feel them way up, and we've got the severity of the symptoms when they're on way down, which is great.
Absolutely,
So again, migraines, I feel like if we spent more time on that left chain like we did today, that we could steadily get this number down. But coming down to just 1 a week,
that's a whole lot better than what it was.
Coming down from just 1 a week is a huge difference here from having 3 or 4.
Oh, definitely.
So, like I said, the progress you make with massage, we can bring your inflammation down, we can bring your range of motion up. Ultimately, though, the weakness in the chain is what's going to help the numbers on the board to stick.
Okay.
Yeah? Okay, so that's what we talk about next.
All right.
Well, hopefully you have enjoyed that window into clinical massage. Again, today's client was thoracic outlet syndrome, numbing, tingling, radiating pain, Also was dealing with the cervicogenic headaches, which we were able to greatly reduce. And the frequency was really hoping to get, below that 5 range. But again, our opponent was a little stronger between the last visit because she was working for 3 days instead of 2. So there was more hours. I should probably be happy that, it didn't get back to like a 7 or 8. It was just another 0.5 up on the registry and still only 1 for the week. So, small victories or, large victories. If you're the person who has been suffering, I'm sure you would prefer to have only 1 migraine as opposed to 3 or 4. So, but the radicular symptoms, we made a major improvement on. And it just comes down to understanding what your client is doing to themselves and what type of energy that takes up, and where is it putting stress on the body. In my sleep position, where am I putting stress on my body in the position that I work in, that I lounge in, that I'm doing daily activities in, and having a therapist that is able to work in reverse. So uh, clinical massage, when I say it's focused, goal oriented, this is what I mean. If you are looking for a therapist who takes these kind of things into account, if you want to leave your pain management team understanding how you got here, then test me out. Information is in the video description on how to reach me. And if you have any questions, or if there's a particular dysfunction or issue that massage is viable for, or if you want to know if massage is a viable option for it, let me know in the comments. And until then, I'll either see you on the table or in the next video. Take care.